Good morning. Thank you for joining us in our webinar presentation today as we talk about treating chronic pain in children. My name is Shalini Shah. I'm Director of Pediatric Pain Services here at UC Irvine Health, and it is my pleasure to talk to you today about what pain means in children, how we assess it, what we do at UC Irvine to treat pain in children, and what are some things that you can do as a parent at home for your child in pain. Welcome to our parents and welcome to our medical colleagues to join us today. Let's start by discussing, imagine what pain feels like in children. Well, it can look like a variety of things. In some children, it can be a daily headache that just doesn't go away. Sometimes I think of the image of the child who fell on the playground and they have a little scrape or a sprain as a result. Sometimes I think of the child who has a persistent tummy ache every night after dinner that just won't go away. And despite the fact that this looks relatively benign, the feeling that the children have inside can be much more. Some children describe it as an electrical sensation, jolt of electricity in the body. Sometimes it can be described as a burning sensation, like walking on hot coals. In some very rare cases, even the most benign stimulus, the smallest stimulus of a feather touching the skin or bed sheets at night, can cause an incredible amount of pain. I'll give you an example. I had a patient, her name was Jenny. Well, she was an energetic 13-year-old girl, a very talented ballerina, and when she came to her pediatrician, she was complaining of heel pain. She said she probably fell in ballet class, nothing out of the ordinary, nothing that's unusual for her. She went to her pediatrician, the pediatrician did the appropriate workup, she was diagnosed with a heel sprain, and was treated appropriately. Here's a picture of her leg wrapped in ace bandages, healing well. But what happened over the next 2 years was very interesting. The pain started to come back. Even after the original heel sprain had healed, the pain gradually increased. She went back to her pediatrician. The workup was negative. The MRI was negative for any edema. The x-rays were negative for any fractures. She even had blood tests, which were negative for infection. So her pediatrician referred her to the orthopedic surgeon, who then referred her to the neurologist, to the rheumatologist. She had gone from doctor to doctor to doctor for multiple opinions. And in the meantime, the pain just kept getting worse. And this is an example of how she presented when she first came to our clinic. She had an intense amount of pain, and this is what had happened because the pain had gone so long untreated. Now, thankfully, this is a very rare case. Most children do not progress to this stage. But what I want to hone in on is that here, left untreated, even the most simple stimulus of a feather touching the skin is exquisitely painful. So the question then becomes, how did the brain perceive this so wrong? Well, conventionally, pain is a protective mechanism. When we put our hand on the stove, the signal from the stove goes to our hand, goes to our spinal cord, up to the brain, and tells us, you got to remove that hand from the stove. It protects us. It's a variety of pain signaling pathways that help us process pain. But what we have actually learned over the last 3 and 4 decades is that it's not just about pain signaling that determines how much we feel pain, but it's this conceptual framework of how old the child is, what's going on at home, underlying anxiety or depression, the expectations of the child, how high functioning the child is, that determines what kind of pain they're going to perceive. So let's take a step back and talk about what types of pain we see and treat commonly. Gratefully, most of the types of pain that we treat in children are benign, which means that there's no structural changes or body tissue injury in most cases. For our athletic children, our divers, our gymnasts, our baseball players, they usually complain of back pain or limb pain, and that goes along because of the repetitive injury that they have. Sometimes we see headache. This can be the migraine type of headache or just that chronic daily headache that never goes away. In some other cases, we see abdominal pain. In fact, one of the most common complaints of children when they go to a gastroenterologist is for abdominal pain. And they've gone through the multiple workup of CAT scans, endoscopies, colonoscopies, and nothing is wrong. Thankfully, nothing is wrong. But the impact that this has on the child is enormous. Because when the child is sick, they don't go to school. And when they don't go to school, they don't perform, they are held back, they don't graduate on time, and essentially what we have is that the child is now no longer able to fulfill their full potential in life. So now let's go back to Jenny. What Jenny was suffering from is something what we call complex regional pain syndrome, or CRPS. It's a nerve type of pain syndrome that's associated with color changes and temperature changes. But what I want to let you know on, when the pain is left untreated, the pain is no longer just a symptom of the disease, but it becomes a disease in and of itself. And here's that picture again, where that smallest stimulus causes intense amount of pain when the pain goes untreated. But thankfully, it responds very well to therapy. So this is Jenny, just 4 weeks after therapy. This is no magical treatment. This is just medications and physical therapy. And this is her at 8 weeks of therapy, back to ballet class. And this is her at 12 weeks. At 3 months, she came into the office, and she came in her ballet outfit to surprise me. She's back on point. For any of you ballerinas out there, she's back on point, and she's doing extremely well. So now I want to move on to how we treat pain in children. Historically, we used to have a belief that children, especially infants, do not feel pain. And if they did, well, they don't create a memory of pain. And if we treat pain, hey, we may create addicts in our children by giving them pain-killing medications. So overall, we had a belief that preventing pain in children had no long-term benefit, and it really just took too much time and effort. Over the last 30 and 40 years, a significant amount of research has been done which demonstrated that just like any other chronic illness, like hypertension, like diabetes, pain itself has a chronic effect. So from the physiological standpoint, the children are always revved up. Their heart rate is elevated, their respiratory rate is elevated, they have high blood pressure. They're constantly functioning at this fight or flight response system. Metabolically, hormones are secreted. The children don't heal their wounds appropriately. They don't want to eat. They don't want to sleep because of the pain. And then when they finally do fall asleep, they can't stay asleep because of the pain. They don't want to function. They don't want to go to school. And they're chronically irritable. And can you imagine the toll that this takes not only on the child, but on the family as well? So what we have, essentially, is a cycle of pain. Pain brings on decreased activity, which brings on decreased school performance because the children don't want to get up and go to school, and now they're being held back. And because of that, now they're not sleeping well. And when they're not sleeping well, they feel socially isolated. Because here they are, they're not in school, they're not going to baseball camp, they're not in basketball camp, they're not playing with the children on the playground, so they feel isolated from their own friends. And that begets some anxiety and depression. And what you have is this downward spiral of negative consequences. So when is it time to see a pediatric pain specialist? Well, as a mom, you can ask yourself, when are we beyond something just being wrong? And as a pediatrician, you can ask yourself, how do you know when it's time to refer? Well, as a pediatric pain specialist, we have the tools necessary to assess children appropriate to their level of functioning. For example, toddlers and preschool children are not able to localize pain, which means they cannot tell you, Mommy, it's my arm that's hurting, or it's my leg that hurts. They're not able to localize pain. So we have to rely on a phases scale in which they're able to point to the diagram that most corresponds to them at that moment. The older children, they're able to communicate a little bit more effectively in regards to their pain. They can use abstract terms, burning, stabbing, stinging, squeezing type of pain descriptions. They respond very well to direct questioning. And we also use faces scales and body outlines and visual analog scales. And that's something that means on a scale of 1 to 10, how severe is your pain? Because conceptually, they're able to understand that now. The bottom line is, pain exists wherever it is and exists whenever the patient says it does. And that's what I want to really let our community physicians know, is that as a parent, we shouldn't be so dismissive, or as a practitioner, we shouldn't be so dismissive of our complaints in our children of pain. So what is our approach? Well, at UC Irvine, we have a Center for Comprehensive Pain Management. And what we do is we take a multidisciplinary approach to the child. That means we take a 360-degree evaluation of the child from the medical doctor's perspective, from the psychologist's perspective. Hey, is there any anxiety? Is there any depression? How are they functioning in school? We also have a physical therapist that evaluates the child, and that person is looking for mobility, functioning, and strength. And for example, when I see the child in initial consultation, I sit down with the family. It's about 30 minutes to an hour interview, and we sit down and we talk together. We talk about the pain. We talk about how it started. But we also talk about the other impact on the family. How is the child going to school? Are they doing well in school? Were they previously an A student and now they're functioning at a B and C level? Are they sleeping all right? What's going on at home? Are mom and dad going through a divorce? Is one child getting a lot more attention than this child, and that's why the pain is coming on? The psychologist will also do some educational and personality testing so we really get to understand who this child is. And what we have found is that there is a significant amount of comorbidity with children in pain and with psychiatric diagnoses. And what that means is that we often find children who have pain also have psychiatric diagnoses. It's not that one leads to the other, but they frequently co-occur. Bottom line is that we have commitment to a therapeutic alliance. Okay? When we see your children at UC Irvine, we also discuss the case with all of your physicians. We speak with your pediatrician, we speak with your rheumatologist, your orthopedic surgeon, your neurologist, your physical therapist, and we come and make a complete goal for the child. Parents, you can do the same thing at home. You shouldn't get to the point where you feel that the pain has taken over the mind, the body, and the spirit of the child. You should not feel that this has unraveled the family life and just breaking up the family. I'll give you an example. For me, when we were living in Boston, I had a daughter, have a daughter, at that time she was a year old, and she suffered a burn injury to both of her legs. It was very unfortunate from a babysitter accident. And we used to go to the burn hospital for daily burn dressing changes. And if anyone knows anything about burns, after a burn the skin is very raw, the nerve endings are exposed, and doing burn dressing changes is exquisitely painful. So I am thinking to myself, how is my daughter going to handle this? I'm revved up. I started to unravel. Here I am as a pediatric pain specialist, and I'm falling apart. What I realized that if I brought a low anxiety state to the scenario, and I calmed myself down, I did my breathing techniques, my child did well. She handled it like a champ. And that's what I want to let you know as mom and dads out there, that you can do the same thing at home. I was able to distract my daughter. I was able to bring her to our happy place and sing songs. She didn't even know what was going on. So, the bottom line is that the children must learn to function in spite of pain. Just because there is pain doesn't mean that there is something wrong with the body. You have to keep moving. You have to keep functioning. As pediatricians in the office, you may want to obtain a history in a very low anxiety, very calm environment. You want to use some of those tools and assessment strategies that we talked about, using the phases scale for the younger children, remembering that they cannot localize pain. You might want to be able to talk about abstract terms, squeezing, burning, those type of things with the older children. Overall, the top 10 reasons to refer to a pediatric pain specialist are when the pain persists. It's been longer than 3 months and the pain has not been relieved. When there are changes in sensory or motor functioning in the child that previously weren't there. When the child has been started on prescription painkillers, you want to see a specialist who manages pain consistently. When the child is starting to withdraw from activities, they're not going on the baseball team, or they're not playing in the swimming pool with the other kids. There's behavioral changes have started to set up. There's anxiety, some depression that you see, some mood changes. School performance starts to decline. Not only they're not going to school, but when they do go to school, they're not staying for the entire school period. They're leaving early, they have tardies, they're late to school. They used to be an A student and not anymore. Sleep disturbances, they're not able to fall asleep, and if they are, they're not able to stay asleep. You go from doctor to doctor to doctor to treat the pain, and still the pain persists, even when the original injury is healed. And that's the case in Jenny, if you remember. The ankle had healed. The sprain had been relieved, but the pain persisted. And when do you refer? When you think about it. The earlier we are in preventing pain in children, the better off the results are, the long-term outcomes. So goals of management in pain management. Yes, I want to decrease pain and suffering in children, but that's not the only goal. I want these children to function. I want them to get up and go back to sports that they enjoyed. I want the family to be united again. Often this can take a toll on the family, just like any chronic illness. We want the family to be united and not be chronically stressed about this. I want the children to promote coping mechanisms. Hey, I don't really need to rely on medications or physical therapy or things like that. I can do this myself. When the pain becomes too much, I'm going to relax. I'm going to breathe through it, and I can do it. And I want to decrease patients' risk from long-term complications. And what I really want you to let you know is that success is on your side. Thankfully, most pain syndromes in children are benign, and most relieve over time. And we're talking within few weeks to few months. So success is on your side. The bottom line is that you are the key. As parents, you're with your child day in and day out. And from one mother to another, I want to let you know I have been there too. And you can do this. You have the tools to assess your children appropriately, and you have the tools to make it better. So thank you for joining us today. It was my pleasure to speak about pain in children. And now I'm happy to take any questions you may have through Twitter and through Facebook. All right, so let's see. Okay, some of the questions that have come in. All right. How long will my child continue to be in pain? Will this continue on to her adulthood? Well, that's a very good question. As we just described, thankfully, most pain syndromes in children do resolve. In fact, 90-95% of pain syndromes in children do resolve. So with the right therapy, with the right eyes on the child, with the right medications and physical therapy, I'm happy to report that most of the pain syndromes will resolve. How does treatment with a pediatric pain specialist differ than the pediatrician? That's a very, very good question. The pediatrician is a vital part of your child's health. They manage the child as a whole. They are the home for the child. They manage all the developmental milestones as well as the common ailments you may see, earaches and toothaches and respiratory infections, things like that. But when it comes to specialized things, such as pain medicine, such as neurological issues, you want to really refer to people who have an eye for dealing with these type of syndromes on a daily basis. So as a pediatric pain specialist, my eyes are on dealing with the pain effectively and making sure that all the other things that we talked about, sleep, school, eating, things like that, personality, all improve as well. All right, these are great questions. Okay, I'm a doctor in the community. How can I have my patient seen by you? Okay, very good question. Here you are. Here is some contact information for our clinic at UC Irvine. But to ensure a smooth referral process, what I would like for you to do is collect all the progress notes that you have on the child, including the initial consultation, any exams that you may have ordered or test results, and make a nice packet and fax it to our office or give us a ring at 949 UCI Pain, and we'd be happy to start the referral process for you. Okay. Can I use my pain doctor to treat my daughter's pain? That's a very interesting question. I get that quite a bit. A lot of adults that I see have pain, and their children consequently have pain as well. And usually they say, hey, a pain doctor is a pain doctor, right? Can't I just go to my normal pain doctor? The answer is no. You can, but you really want someone, again, who focuses on pediatrics. And like we talked about, it's not just the pain that we're trying to treat, but it's the global health of the child, the functioning, the school performance. And we take that all into consideration when we treat the child. We're not just treating the pain. Okay. My child has missed a lot of school due to his pain. Are there any resources you can recommend to help? That is a fabulous question because as we talked about, most of the children are not in school, or some children are missing school because of their pain. So what we do with our team is speak with the school directly. We get on the phone and we talk to them about how much school is missed and what plans we can put into place with the school district to help the child, A, catch up, and B, give the child more allotment for test taking, for homework assignments, things like that. So we help you with the entire process. Like I said, we're in this for the child to improve and to live his or her full potential. So whatever we can do, please do not hesitate to ask us. Okay, these are wonderful questions. Keep them coming in. No questions are bad questions. Okay, let's see. Why are antidepressants and seizure medications commonly used in the treatment of pain? Wow, that's a good question. So what we have learned over the last 60 to 70 years in regards to pain research is that pain travels in the same tracks with anxiety and depression. And that when we're able to treat the anxiety and depression, we did a better job at treating the pain. And it's not to say that you treat one and the other one will be relieved, but pain is easier to treat when we attack the anxiety and depression first. So that's why we typically use antidepressants for treatment of pain. That's a very good question. Okay. My child is currently on prescription painkillers. Is it safe? So, like we talked about, prescription painkillers do have an addiction potential, what we call in the medical community a dependence, physical dependence. And over time, what we have noticed is when the child comes in with a 5 out of 10 pain, they're on chronic prescription painkilling medications, sometimes the pain progresses. It progresses to a 6 out of 10, to a 7 out of 10, despite being on pain-killing medications. So A, the pain can get worse with these types of medications, and B, there's an addictive potential. So it opens up the closet to alcohol abuse in the future, tobacco abuse in the future, and again, not living to your full potential. So as much as we can, we try to get the children off the pain-killing medications. We have a variety of other things that we can offer children, and they do remarkably well. So even in the absence of pain-killing medications, your child will do well. These are wonderful. Okay. How can a pediatrician like myself provide the best pain care to their patients? Very good question. Like I talked about, you want to evaluate the child in a low anxiety environment. You want to keep the room dimly lit and don't use the word pain. The more you focus on the pain, the more their system gets revved up. Use other words. When this happens to you, what do you feel? Use words that they may relate to, owie or boo-woo or things like that. You don't want to use the word pain, okay, when you talk about treating pain in children. The other thing you want to do is distract the child. So while you're talking to mom or while you're doing your physical exam, you really want to use a lot of distraction techniques, candy, lollipops, games, things like that, so the child is not focused on pain. Because you also want to evaluate their functioning. So distraction is good to evaluate functioning as well. Okay, what other questions do we have? These are wonderful questions. Can you describe me why we use nerve blocks to treat pain? Okay, that's a very good question. Not all children, when they have pain, or not all adults, when we have pain, will need nerve blocks. There are a variety of ways that we can, variety of methods that we have to treat pain. Sometimes it's medications, sometimes it's physical therapy, sometimes it's just time and the pain goes away. In some cases where there is a distinct nerve injury or a nerve pain syndrome, it may be beneficial to block the nerve with the combination of medications, and that will help A, come off the medications, and B, give you some persistent, long-lasting relief to decrease inflammation. Very good questions. And I think we have them all. So thank you very much. It was truly my pleasure to speak with you today. It's obviously my passion to talk about pain in children and how we can treat it effectively in a very meaningful way. And I really appreciate your response on Twitter and on Facebook with the wonderful questions you have. And at any point, please feel free to contact me. Thank you very much.